Hello, my name is Raj Thakkar and I'm a GP and a Clinical Commissioning Director at Chiltern and Aylesbury Vale CCGs. This talk is on falls and it's designed to help you reduce your risk of falls and to spread the word as far and as wide as possible so we can increase the health of bucks and reduce the falls burden we see across our county. You'll see on the screen in front of you there's an ECG or a heart tracing. And this patient was falling and I fitted a monitor onto her and you can see that she wasn't getting a heartbeat for over 5 seconds. Now think about what would have happened to that lady had she fallen at the top of the stairs. And what we want to do is to prevent those sorts of falls because the consequences of those could be disastrous. The idea then is not only to take heed of what's in this slide set, to go home to look at your own falls risk, but to spread the word as far and as wide as possible. So this slide shows a rather alarming set of statistics. 30% of those over the age of 65 and 50% of those over the age of 80 will fall at least once per year. More importantly, 50% of falls are preventable with simple and practical steps. So if you think back to your own falls risk, the question to ask yourself is, have you fallen in the past? What did it feel like? Were you scared? What would have happened if you couldn't get help? Or were you stuck on the floor for hours at a time? There are many people who are unable to get help and maybe stuck on the floor for hours or even days at a time. And I was certainly at a course recently where a patient had been on the floor for 3 or 4 days, having suffered hypothermia, fear. Unfortunately, she soiled herself, she was confused, dehydrated, and that's a very, very frightening statistic and scenario, but it happens and we see it all the time in our accident and emergency departments. It's something that we want to prevent. And I want you to imagine that lady every time you are faced with a scenario where you might fall, and think about your own falls risk. And if you can prevent a fall by being proactive about it in your own home, you might stop yourself becoming that poor lady. So here's some more statistics. So falls cost the NHS £2.3 billion a year, and around half are preventable. So we can save over £1 billion in the UK and reinvest that money for other health services. Obviously, if people fall and if they are taken to hospital, that creates a burden on the NHS and it stops people being able to access healthcare more easily because patients are in hospital having fallen. So if we can reduce that burden, then we can support the whole community. 70,000 hip fractures are because of falls usually, and the problem with a hip fracture is it affects mobility, increases the risk of pneumonia, increases the risk of clots on the leg and on the lungs. So it's a major problem we see in this country. And if we look at the consequences for the individual, we see bony fractures, but we also see head injuries. We see loss of confidence, we see anxiety, we see depression, we see death, and it's something we really do need to prevent and be more proactive about. It's really important to remember that falls is not a diagnosis, just like breathlessness isn't a diagnosis. So with breathlessness, you may be anemic, you might have a heart problem, you might have a lung problem, and so on. With falls, it's the same thing. There's several different causes for falls. So if you're falling or a loved one is falling, don't make the assumption you're just tripping over. There might be a serious underlying issue, just like that patient I talked about at the beginning of the slides. So this is a bit of a busy slide, but if you look at the first column on the left, a third of falls are because of issues around the home or the environment. So turned up rugs, doormats, loose slippers, a very common problem, slippery baths, poor lighting and poor vision, living alone and alcohol use, really common problems, and I really hope people do go home and look at their falls risk, remove those mats and doormats, remove those obstacles on the floor, change your slippers. These things can save your life, and what we don't want people to do is to leave it till it's too late. The middle column there is muscular disorders, muscle weakness, very, very common problem. So if you can't stand up from a chair without using your hands, then your thigh muscles are going to be weak, and it's really important to get those strong and exercise them to reduce your risk of either stumbling, or if you do stumble and fall, to help you get up more easily. Neurological problems are very difficult to manage, and again, it's very, very important that if you do fall, or if you feel you're at risk of falling, speak to somebody, get some help, speak to your doctor. Further causes of falls include cardiac, systemic, and medication issues. So if we start on the left in terms of the cardiac problems, low blood pressure is a very common problem we see, particularly in the elderly, especially those on blood pressure medication. So when people stand up, they feel dizzy as their blood pressure drops and are at risk of falling down. Other issues include heart failure, abnormal heart rhythms, and valve problems. If you go to the middle column, infection is a very, very common cause of falls, and we often see patients with urine infections and chest infections brought into our casualty departments after having fallen. Urine is a very common issue that can be prevented by good hydration, and that's particularly important in the summertime when patients don't drink enough fluids. Vitamin D deficiency is very common, that causes weakness of our muscles and can affect our immune system. Looking to the right hand column, if you're on 4 or more drugs, you have a 30% increased risk of falling if you live in the community, or a 400% increased risk if you live in a nursing home. I'm not advocating stopping your drugs, but certainly have a chat with your GP or pharmacist in case they can cut down drugs that don't add value. It's absolutely essential that we remain active. Being sedate can increase the risk of muscle wasting, poor balance, and falls. If our muscles are strong, then we're far less likely to fall, and if we do fall, we're more likely to be able to get up. So there's lots of things you can do to keep your muscles strong, and that includes balance exercises, gardening, housework, walking to the shops, exercise classes, and particularly yoga or Tai Chi. So this is a quick slide on exercising with a chair, and essentially it's about strengthening those muscles at the top of the leg. And if you exercise just 10 times a day, strengthening those muscles, then you can do yourself a lot of good and massively reduce your risk. So certainly worth taking a few seconds to look at this slide. Active Bucks is a county-wide programme which is run by the County Council and offers a wide variety of activities near you. It's definitely worth logging onto their website, and it gives you an opportunity to engage in exercises that will strengthen your muscles and certainly reduce your chance of falling. If you do fall, you may have done yourself a serious injury. So sometimes it's better to leave yourself on the floor and get some help. And that's a really important point, because if you fall, what will you do? How will you get help? If you don't have an alarm and you don't have a mobile phone on you, then it might be you're stuck at home for hours or days at a time on the floor, or even outside. So it's really, really important that you think about your own falls risk and how you manage it if you were to fall at home. This slide kind of summarises what I've just said, really. So This is about being proactive. It's about you managing your own risk, and it's also about you thinking, what would I do if I did fall, and preventing any serious injuries happening to yourself. Okay, so we're clearly very passionate about falls in Buckinghamshire. We're doing lots of things to improve the health of our community, but a big part of it is actually educating the public. So I really hope this doesn't just stay as a presentation, but you go home, you look at your falls risk, you speak to your neighbours who you think are at risk, you speak to your loved ones. We need to spread the word. We need to help people, educate people to reduce their falls risk as much as possible in order to stop the burden we're seeing at the moment. So this is the final slide, and it summarises what I've talked about so far. It's really important that you think about your own risk. What can you do to reduce your risk at home, getting rid of those obstacles? Spread the word to your friends and family. Get your flu jab, get your pneumonia jab. Exercise on a regular basis, and think about what you might do if you did fall. So thanks very much for listening. Please do spread the word. Please send this slide set as far as you can, and I wish you the best of health.